which is actually the last day of our regional workshop on undertaking inequality assessments. So thank you for joining us again this morning, and we hope the last 3 days have actually inspired you to start thinking about designing and implementing such assessments in your own national context. And today we will walk you through a few more tools and things that you need to know to plan and design such assessments. So yesterday, as you know, in the afternoon sessions, we had already begun to start talking about how to interpret the findings, the results, and how to bring these results for policy discussions. And today we are actually going to delve a bit more deeper into how to elevate our results and findings to actually formulate policy recommendations and even develop technical reports. So we have a couple of exercises today where we will encourage you to actually start formulating or drafting some of these policy recommendations or summaries. These are not necessarily easy to do. They do not come naturally to everyone. So we request you to try and do your best with this drafting or formulation part. And please, during the plenary sessions, don't be shy. Please do share your drafts for everyone to see and for everyone to benefit from. At the same time, today, sometime midway through the session, during the break, we will be posting an evaluation. I think my colleague Panita already had the QR code to the evaluation, workshop evaluation on the screen when we started. And she'll post it once again in the chat box. So please do take about 10 minutes to complete the workshop evaluation for us, which will really help us in making improvements in future events. Now, for the structure of the day today, we do have, I think, about 3 or 4 lectures, but Rennie has made a slight adjustment so that we can spare a bit more time to work through the exercises. So I'll now turn the floor to Rennie, and she'll tell us what the agenda for the day is going to look like. So thank you once again, and over to you, Rennie.
Thanks, Sharita, and welcome colleagues to day 4, our final day. So as Sharita mentioned, we're going to adjust the schedule slightly. So we got a little farther yesterday than we anticipated for the last exercise, which is great. We were able to do it together and also discuss it. So we have a little bit more time today. But also, as I was trying to write the answer key for this exercise, I wrote the exercise myself, and I'm a statistician and I'm an expert in this area, and it still took me maybe 30 minutes to write it up the way I wanted to get it. And so I'm a native English speaker, and in all of these cases, I wanted to make sure that those who aren't native speakers, who maybe aren't experts in this area, and obviously you didn't write the exercise, that you have enough time to go through this. So I will share the screen briefly with kind of the new idea of the agenda for today, so you can just get an idea of the plan. So let's see here. Okay, so you should be able to see this now. So we're going to start off, so instead of having the discussion from yesterday's exercise, we'll go ahead and go right into the lectures. And instead of covering deaths and having an exercise and covering births and having an exercise, what we're going to do instead, we'll have the lectures first and then an exercise. And so instead of doing 2 similar exercises, one on deaths and one on births, we'll just do one, but we'll spend more time with it and go in depth and make sure that we can have some more discussion. So that's why we see exercise 9 taken out, and then we'll continue with the lectures, and at the end have a little bit more discussion. I think that Sharita and maybe some other colleagues have some questions for you as well, and it's likely we'll end the day a little bit early. I think we originally had said we were going to end around 1 o'clock Bangkok time. I think we might go a little bit past that, but we should be wrapping up before 2 today. I updated a copy of the agenda and put it in the Google Drive as well, in case anybody wants to have a look and follow along as we go. So, sorry, I'm working off 2 screens and it's being a little bit wonky today. Apologies for that. Okay, so if I just want to open the floor and see if there was any other questions or comments maybe from yesterday or the last few days, please feel free to raise your hand or put a message in the chat box as well. No burning comments or questions, I will. Oh, well, now I'm trying to share my screen, but now it doesn't recognize my slides. So give me a second and let me see what the problem is. Yeah, they got minimized somehow. Here we go. Okay. Try this again. Okay, here we go. So today, as Rita mentioned, we're going to be delving into using your data to inform policy interventions and providing recommendations to policymakers. So the first lecture will be focusing on deaths, and then the next lecture will be talking about births. So the word policy often makes us a little bit worried or scared, and we have these ideas about having to stand before Parliament or maybe even the Prime Minister and making a speech or something. So this is what it conjures up in my mind sometimes. But it doesn't necessarily have to be so high level and scary, essentially. There's a lot of ways that we can use policy on the grassroots or kind of on the ground level that can really affect change. So when we think about policy, don't just think about the formal, say, changing a law or regulation and having to go through this really deep, in-depth legislative process. There's a lot of operational ways that we can think about policy and affecting change. So those could be improving standing operating procedures, some kind of program development, even at the low level. Perhaps there's some things that can be done that you don't have to get many chains of approval for, but they can greatly improve registration. It can also affect the allocation of resources, maybe even within a division or a department. And it can also be about just doing more research, maybe just doing a few focus groups or a little bit more interviews with a certain population in a certain region or whatnot. So it doesn't have to be quite so big and scary as sometimes what we think when we think about policymakers or policy use. We do want to use the results of our inequality assessment to inform policy and kind of have a continual feedback loop that we keep assessing how our interventions are doing, if they're improving the situation, and continuing working towards getting everyone in the picture. So this nice little kind of policy loop picture here, starting with number 1, problem identification. This would be derived from our inequality assessment. So hopefully from that, we would be able to determine who is being left behind. Or if the data isn't good enough, we could also just determine what are some of the problems with the data and what do we need to collect in order to do an inequality assessment. And then going to the next step of policy analysis, at this point, we want to think about, okay, what do we need to do to be more inclusive and have greater completeness in registration? What are our recommendations to get there? What are maybe some areas we need to investigate further? So say that we see differentials between ethnicities or by sex, but we don't really know why. So we can list some areas that we need to do further investigation so we can think about what kind of recommendations to give or what kind of interventions to put in place to improve registration. And then finally, we can think about how to better collect the data in the future to inform future inequality assessments to better understand who is being left behind. And then from there, we have the strategy and policy development. And so this is when you start to formulate that. And again, it could be on many levels, a higher level, a lower level, et cetera, depending on what kind of interventions you're trying to put in place. So maybe this could even just be, can you change the way that you collect residence data, change it from a text field to a drop-down box? And if that's something that's very simple to do and agreeable to the data collector, maybe that's just a discussion between department heads, for example. And then here we have the policy enactment. So, say you change your drop-down box and then you make it go live. And then from there, data collection, they say, okay, from now on, everybody, and this is how we're going to collect it starting tomorrow or whatnot. And then your implementation is when you actually start doing that policy. So people are using, in our example, the drop-down box versus the open text field. When we're doing an inequality assessment, it's our responsibility to the policymakers and to the data users to succinctly summarize the following. It's very important that we don't go through this whole exercise, do all this work, all this analysis, and it just sits there. So we really need to make clear, what do our findings mean and why should you care? What are our recommendations based on the findings? And what are the next steps to work towards those recommendations? And I just I want to reiterate that it's the core group, that analyst's responsibility to not only do the analysis, but to provide the recommendations as well. And you might, a lot of you, if you're like statisticians like me, you like data, you like to make graphs and you can kind of explain what they mean, but you might feel a little bit uncomfortable writing recommendations. But you have to keep in mind that policymakers, especially on the higher level, they're not experts in improving civil registration. They might barely understand what vital statistics are, but you are the experts. And so it is your job to make sure that you can also provide the recommendations and the findings of what your data mean. And it's not just necessarily one individual or one entity, such as the statistical office. It would be that core group of people working on the assessment. So collaboration between the Ministry of Health and the National Statistical Office and the Civil Registry and any other key players that might have been involved. So when we are trying to address policymakers and really affect change, we need to kind of speak in their language and think about things from their perspective. And one way to think about this is, say that you got in an elevator with them and you only had 30 seconds to make your pitch or kind of convey your points. So what would you say if you only had a very short amount of time? Because a lot of these people, especially the higher up the chain you go, they're very, very busy. They have many issues that they deal with on a daily basis, many documents cross their desk. They won't have time to read your in-depth technical report. They probably won't even have time to read a 5-page summary. So you need to think about what you really want to say and say 2 to 3 bullet points, and maybe a couple of very nice, flashy, clear, simple figures. And just, kind of, if you start with 2 or 3 bullet points, you can expand this into, say, maybe 1 paragraph summary. So we need to make sure we use simple language. So if even something like, if we say there's a differential in sex registration of deaths or something, that might be too much depending on the person that you're dealing with. So you might have to say, male deaths are more likely to be registered than female deaths, or something just very clear and simple. And when you're writing your brief for the policymakers, make sure you put your most important point first. So if your most critical important point is there's a difference between males and females, put that first. Or if it's that this ethnicity is, like 50% less registration than this other ethnicity, that's your first point. And then again, like as we mentioned, don't forget to include your recommendations. So we'll go into a little bit more detail of summarizing death registration completeness for policymakers. So we got to think about, from policymakers' perspective, what their interests are and what they care about. And when we talk about CRVS, every person has a right to documentation and also commemorating their life or their death or their marriage or whatnot. But what the policymaker would be most interested in is how is the public health of the country faring, especially if they're a higher level politician or someone who actually institutes these kind of policies. Under their leadership, is longevity increasing? Are people's health situation improving? Are people living longer, et cetera? They're also interested in the economical and perhaps political implications of death registries. So when we write up our findings and our brief for policymakers, we need to make sure we include how these findings, what does it mean in terms of health policy, and why it's important to monitor public health through civil registration data, these death registration completeness, these vital statistics, etc. The other thing we might need to make a case for, if you don't have complete death registration, then people could perhaps illegally still be taking their pensions. And there's other issues such as voter registration fraud. You don't want dead people voting, which all of these things are of interest to policymakers. So maybe when you're trying to make your pitch of why death registration completeness is important, some of these key points could be helpful to include. When we're summarizing our findings from the inequality assessment, we want to make sure that we include no more than 5, but maybe 2 or 3 kind of key findings that we really want to bring to their attention. So who is being left behind, and why do we care? What does it mean? Why are we looking at this? What are our recommendations to improve the situation? And if there's any absolutely critical caveats or considerations, you can put a note in there, maybe put like a little footnote, but try to limit this so they don't get too technical or lost in the weeds. And then remember, a picture is worth 1,000 words. So if you can include a clear, simple, colorful, eye-catching graphic wherever possible, this is a great thing to do. So here is an example for death registration completeness in our fictional country of Papulandia. And we are saying Indigenous infants, this is one of our biggest concerns, just how low they are compared to the adult population. So what we might say is less than 1 in 3 Indigenous infant deaths are being registered compared to 70% or more of adult deaths. When we do not know how many Indigenous infants are dying and what they are dying from, we cannot put in place interventions to save the lives of future infants. So just as an example, something clear, like here's a situation, here's why we care, and then maybe our next paragraph would be a recommendation on what to do to improve the situation. So here we have our recommendation on what to do about these underregistered infant deaths. So many of these infant deaths occur in the first few days of life while mother and child are still in the hospital. It is critical to require deaths recorded in health facilities be linked to the civil registry database. Better integrated databases would capture up to 80% of the missing deaths to better allocate resources to these facilities who need them most to save infant lives. So it's a little bit wordy. I'm sure it could be said better, but we're saying here's our recommendation. We want to make sure that these are captured and they're linked, and here's what we think the impact will be. And maybe in your first attempt, you can assess how much it'll increase or how much it'll help. But the point is you're allocating resources. Well, you're identifying the health facilities, maybe with the most infant deaths, and you're allocating resources to them so that they can save lives of children in the future. So again, you might feel a little bit uncomfortable. You might be okay writing up your summary saying, okay, look, infant deaths are only 30% compared to adult deaths at 70%, something like that, easy peasy. But you might feel a little bit nervous maybe going on the next step. But remember that you are the expert. So the policymakers need a short summary of the problem and the proposed solutions. And you can, when you first start to do this brief, you don't have to feel like this is the end all be all. It can kind of be a living draft or just a starting point, at least to generate discussion. And then maybe as you get some more experts or other stakeholders involved, it can kind of evolve over time and work towards improving the situation in your country. If you are, maybe you're a very specialized statistician and you're really into data, but you're not really sure about improving civil registration in general, it's important that we consult our colleagues. And this should be done routinely anyways. This is not a one-man game. It should be, again, the kind of core group of actors working together. And these inequality assessments are collaborative efforts. So it's important to get feedback from colleagues and to support you when you're writing up your recommendations. And then finally, to note that consulting other data sources or maybe other inequality assessments is really helpful when you're drafting some of these briefs. So don't get any too technical or too long or too much information. But if you can put a few other data points on the graph or make a nice kind of map based on other sources, this will help strengthen your argument. So for example, if we were trying to get more registry offices built in these kind of remote areas, a nice little, obviously this is not the best picture, but you can make it better. But a little picture like this, just showing where the registry's offices are in each province, and it's just very clear that there's nothing in the Eastern Isle or the Eastern Province. So this can help you when you're advocating for better access to civil registration, something like this. If you were really fancy, what would be great is if you could do a color-coded map, maybe with the GPS points of the civil registry offices, and kind of like, here's a 5-kilometer circle or a 10-kilometer circle or 20-kilometer circle, and you can kind of see spatially how far the things are from the civil registry. I'm not that fancy. So if we were to summarize from our Poplandia exercise yesterday, here's kind of our 5 perhaps key findings. So children under age 1 are the least likely to have their deaths registered, especially Indigenous children. Indigenous women are the most under-registered group population-wide. I would say within the adult population, I should edit that. Both Indigenous males and females are less likely to have their deaths registered compared to Marzians. There are sex differentials in registration within both the Marzian and the Indigenous population. And finally, further investigation is needed to understand the data quality issues for Marzian death registration. And if we recall, we saw greater than 100% completeness in several age groups, particularly among males. And so we need to understand if that was duplicates, if it was missing records from Ministry of Health, maybe definition, etc. So based on our key points that we found, here are some example policy recommendations. So for number 1, for example, for the infants, a regulation should be enacted to require health facilities to report all deaths to the Civil Registry Office. Electronic linkages through databases should be the ultimate goal to capture those deaths least likely to be registered. And there's no right or wrong answers. This is just trying to give you an example. It really depends on the country situation and, of course, the population you're talking about and what you're trying to achieve. So this is just thinking about, your particular situation and what's going on. But I'm just trying to give you a few, short, simple answers in terms of maybe what you might say for policy recommendations. So for the second one, when we were talking about Indigenous women, and just the Indigenous population in general. Greater access to civil registration centers is critically needed. Provinces with no registration offices, such as the Eastern Province and Eastern Isle, should be prioritized for increased access. And maybe over time, if you could do a little bit more research, or if you maybe, it came down to, okay, you have this much budget or what you want to do, you could even kind of take the next step and say something like, civil registry offices should be located in every town with a population of, 20,000, for example, or more. Increased mobile registration is needed to service those populations more than 10 kilometers from a civil registration office. So obviously these numbers, depend on your country situation and your budget and kind of the, lots of other contexts. But again, just kind of an example of something you might want to think about. So the next one is relative to the Indigenous population again. So awareness raising and targeted campaigns for Indigenous populations are needed to improve registration, especially among Indigenous women. And the last one is about the research we still need. So funds should be allocated for further research into why there are sex differentials in registration. For example, focus groups for understanding barriers and cultural beliefs are needed to inform interventions to improve registration among women. So we've done our inequality assessment. We have gone through the data quality exercise. We look at our results over time. They look pretty consistent, say over time or compared to other sources. So we're feeling pretty good about the outcome and our data. So now what do we do? So perhaps the first step would be to write 2 to 3 sentences, just summarizing our data and what they mean and maybe why we care. And then explain the policy implications that your data have. and some key recommendations that you think might remedy the situation. And if you're unsure, or maybe there's not really a clear story with your data, or it looks a little strange, it's perfectly okay in your report or your assessment to say that more investigation is needed, or maybe there's poor data quality, or here's what we would do in the future. And just make sure that you document and you highlight any issues with data, if there's any subpopulations missing, if the certain data is of poor quality, et cetera, so that could be one of the focuses going forward. So we're not going to do the exercise just yet, but I will pause for a second, check in with the chat box and everybody and see if there's maybe any comments or questions. And if so far so good, then we can continue to the next lecture about births. Okay, so if no comments or questions, we can keep going to discuss reporting our findings on birth registration completeness for policymakers. So a lot of these are kind of redundant. I just wanted to keep them in there in case we broke up the lectures or we need to reference them again. But it's the same idea. So for birth, we still need to say what our findings mean, kind of why do we care, what are our recommendations, and what are our next steps. And again, this is just talking about we need to be brief, 1 page or less summary for policymakers, simple language, etc. Same thing we just discussed with DES. So in terms of births, the appeal might be slightly different. So while death registration completeness might be centered around monitoring and improving public health and kind of the life expectancy of the population, et cetera, a birth certificate, instead of having not just public health implications, it also has personal and individual implications. So, if you consider from a policymaker's perspective, there's several things that birth registration completeness can affect. So of course, public health policy, because you want to make sure that there are enough health centers and places for women to give birth and vaccines for the children and all these things going forward. That's very important for the health and survival of your population. They also want to know if their population is growing or decreasing, because they need to plan for things like schools. Will there be enough teachers? Is there enough roads? All of these kind of things in the future. So that kind of considerations are also very important to have complete birth registration. But then if you think about on the individual perspective, an individual has a right to things like an education and a legal identity, and they often need a birth certificate to acquire an education or a national ID or a passport. In some countries, you need a birth certificate in order to get married and have your marriage certificate. As you go on later in life, more prestigious, probably better paying jobs would require a legal identity and might require you to present your birth certificate. And you might need a birth certificate to open a bank account. So if you don't have a birth certificate, you can become very disadvantaged and you won't reach your full potential or productivity, and this can have an impact on the economic, holistically outcome of the country, right? So policymakers are interested in from the individual perspective, the public health perspective, but also, perhaps the holistic perspective over time. And in theory, if you're born at some point, you will reach adulthood and you will be a voter as well. And so you might be a constituent of this person, or they want to make sure that their population is not too upset with them. So there's a lot of different perspectives here when thinking about birth registration and appealing to policymakers. So very similarly, we want to have our very few 2 to 5 key points saying who's left behind and why do we care, what is our recommendation to improve the situation, and then have a nice graph or figure if we can. So here's an example for birth registration, again, Poplandia. And if you recall yesterday, we were looking at the young teenage mothers, and we found that the unmarried mothers have quite a bit lower registration. And so in this example, we see, 50% compared to 91% of all Poplandia mothers. So summarizing this, we might say just 50% of unmarried Indigenous teenage mothers register the birth of their child compared to 91% of the population at large. These children may end up more economically, educationally, and socially disadvantaged without access to a birth certificate. So stating what we found and why it matters, and then the next step would be to write a recommendation for improvement. So again, this is just an example. It depends on the country context. But in this example, we might say the birth registration law needs to be amended so that a marriage certificate is not required for birth registration. This will ensure equal access to birth registration for all. So we're assuming in Poplandia, a marriage certificate is required for birth registration, and that might be some of the issues. There's a larger barrier for unmarried mothers to register the birth. Again, you might feel uncomfortable writing up recommendations, but it's very important that you do. You are the expert. With birth registration, there is likely to be a little bit more data. So if you had a DHS or a mix, you might be able to find some other disaggregated data, especially if there was several surveys at different points in time. So it's helpful to perhaps have a graph, something like this, that kind of shows the trends over time. And in this example, the fact that registration hasn't really improved at all, it's very flat, especially for the Indigenous population, is a good lobbying point to say, look, it's been 4 years, nothing's really changed. We really need to do something particularly about the Indigenous population to help support them, be it mobile registration or outreach or whatever it is, depending on the country aspect. So from our work yesterday, when we looked at Poplandia and birth registration completeness, so I went over 5. I cheated a little bit. Here's 6 findings, but here's kind of the summary of what we found yesterday that you might want to think about for key points. So young unmarried Indigenous mothers are the least likely to register births. Young unmarried Marzians are less likely to register births than their married counterparts. Those living in the eastern part of the country, especially Eastern Isle, have no registry offices and are the least likely to register births. I should have put compared to other provinces there. Across all ages, Indigenous mothers have lower rates of birth registration compared to Marzian mothers. And younger mothers and older mothers are slightly more likely to register a male child compared to a female child. Further investigation needed to understand the impact of poverty, education, and the intersect with age, ethnicity, and geography. And we might also want to investigate if there is something going on in terms of young mothers or old mothers registering males versus females. And perhaps also mention, I think in the exercise, it was the Ministry of Education data we used didn't collect things like usual residents. So maybe we say, that's one of the, that would be more of a recommendation. So hopefully that's on the next slide. So here's our recommendations based on our findings. So the first one, we already kind of read something similar, but amend the birth registration law so that it does not prohibit registration by single or underage mothers. Similarly, educate registry staff so that young single mothers do not experience stigma when registering births. And then in terms of our geography problems, greater access to civil registration centers is critically needed. Provinces with no registration offices, such as the Eastern Province and Eastern Isle, should be prioritized for increased access. And so if we wanted to get more in detail, or maybe we do some more research over time, here's just kind of an example sentence we could include. We could aim so that, say, X%, whatever it be, 90%, etc., of the population lives within Y kilometers, say 10 kilometers, of a registry office. Increase the number of mobile campaigns in the interim to service remote populations, especially targeted to young single mothers and Indigenous mothers. And finally, fund research to investigate why there are sex differentials in registration among older and younger mothers. So with that, I think we are ready for our exercise. But does anyone have any comments or questions? I see a comment in the chat box. Do you want to perhaps unmute yourselves and ask your question? Our colleague from Rajasthan.
Sure, ma'am. In fact, my question was about the duration of the IA. Should IA be a regular affair, quarterly, half yearly, or yearly affair for the organization conducting it? Secondly, when we do the analysis about the reports and all, should we engage an expert from outside, independent experts, or should we engage experts from the organization itself, like CRO or NSO?
Okay, so both good questions. So in terms of the regularity of inequality assessments, ideally, if you could do them at the very least every 5 to 7 years, because it depends on the country context again, because if it requires some planning and it requires a lot of work with other line ministries and also you got to think about you're going to have some recommendations and some interventions to improve registration, and then you want to monitor those in the next one to see if they work. So you got to give it some time. So if it's simple and easy to say every year, look at inequalities in registration, that's great. But when you think kind of maybe perhaps more holistically and big picture in terms of affecting policy, changing, putting in place interventions to improve registration and then monitoring those and then doing another assessment, you're probably looking at a longer, say 5 to 7 year period. And we'll talk about that a little bit more in the final lecture. And then the second question in terms of who should you engage, I mean, that's also a little bit specific, country specific. It definitely should be a strong partnership between the Statistical Office, the National Statistical Office, the Civil Registry, Ministry of Health at the very least. And if within that, say, core group of people, there's expertise and you feel comfortable to do it on your own, that's fantastic, and move forward with that as you can. But if you feel like there isn't enough expertise or you need some outside support, then at that point, yes, it probably would be helpful to engage an expert and perhaps kind of guide it forward, and especially maybe for the first go around to help you get through it and build some capacity so that you're able to do it again in, say, 5 to 7 years' time. Hopefully that answers the question.
Sure, ma'am. Thank you.
Okay, great. Any other questions or comments? So I think what we'll do is similar to yesterday. We will kind of read piece by piece the exercise together. I'll give you a few minutes. You can post to the Jamboard. And as we mentioned, this is kind of practice writing up our findings for policymakers. So why don't we go ahead and do exercise 8 if we want to open that, and I can share my screen. So exercise 8 will be in the Google Drive. And find it as well. I have to actually open it on my computer as well. Give me 1 second. Okay. Okay, here we go. And then let me try to zoom in a little bit so that you can see my screen a little bit better. So this exercise focuses on death registration completeness and writing up our findings for policymakers. So and then in this exercise, let's assume it's kind of maybe a higher or mid-level policymaker. So someone that can actually affect some, at least standard operating procedures, or maybe even higher if we need to improve anything around, say, the legislation of registration. So you will see here that, again, we're looking at our fictional country of Poplandia. And so if you recall yesterday, there were some errors in terms of completeness being too high. So let's say they went back, they did some data quality checks, they did some cleaning, and then this is what they came up with for their final analysis. This is the final. And if it's helpful as well, you can see the table down here with the percent completeness. So we have by ethnicity and by sex and by age group. So what I would like you to do is have a look at the graph, have a look at the table, and then think about if you can just write 3 bullet points summarizing the key takeaways. So when you look at this graph here, what is maybe the first most important thing that you notice, or the first most important finding? What is the second? And what is the third? And it's okay if maybe you're not sure what's most important or not important, but just kind of think about 3 key things and write bullet points to summarize what you think they might be. And again, in this case, there's not really a right or wrong answer because you don't really know that much about Poplandia. It's a fictional country. There's probably lots of national context that could affect your choice of this is the absolute most critical issue. In your own country, you would have a better knowledge and probably be able to better pinpoint what you should focus your attention on. But just if you were to look at the graph and the table, let's summarize our 3 key points. And then we'll go over to the Jamboard and we can post our bullet points. Maybe if you can label them 1, 2, 3 on your sticky, and we can discuss and just kind of see what everyone's thoughts are. So I'm going to give you 10 minutes to have a think about this, have a look at the data, and just write a few bullet points, and then we can circle back and discuss. And I just shared, hopefully you can see at the Jamboard, we're on slide number 13. So when you have your bullet points ready, go ahead and post them on a sticky and you can paste them there. Okay, I see a number of you have posted your thoughts, which is great. So if anyone hasn't, please go ahead and feel free to post the bullet points that maybe what you think are the key takeaways from the findings of their inequality assessment. And we'll just have a look at some of the ones here. Would anyone be willing to share their thoughts on why they chose maybe the findings they did, why they thought they were the most critical ones? And if I don't get volunteers throughout the day, by the end, I'm going to start calling on people. So anyone want to raise their hand? Wait, maybe what if I pick one? I'm not sure who wrote this nice orange one right here. Maybe the author of the orange one wants to read what their summary was and maybe tell us a little bit why they chose this one.
Yeah, this one me, ma'am.
Okay, great. Go ahead. So tell us what you think.
Ma'am, that is what I derived from the table and the graph together. But I found that the death registration of the indigenous children below 1 year of age is very low in comparison to the counterparts in the margin. And also the same way, second point is the average death registration of indigenous females is also low in comparison to their margin counterparts. There are some 100% death registrations which have been showing so far as margin females and males are concerned. Uh, most of the cases, like there's so many age groups where 100% of death registration is showing, which need to be re-verified, rechecked whether they're right or not. Even at one place, margin male, there is 101% of death registration also. So there is a kind of little doubt on the data. It is my third point, ma'am. Thank you.
Yeah, fantastic. So absolutely, the infant death is really critical because we see that it's quite a bit lower than the other age groups. So definitely a key takeaway, and also that the indigenous female is low compared to everyone. Really, all the other, they're the lowest adult population. So something is going on with them. And yes, you did notice that, and a couple of other people I think also commented on, there is still, I think it was 101 or 102% completeness for a couple of the age groups. So the data is not perfect. It's definitely not perfect. In this example, I was thinking they went back and rechecked it and they did the best they could. So this is kind of just maybe an example to show that you're doing the best you can with the data that you have, and it's probably not going to be perfect, but you can still draw conclusions that you feel pretty confident and comfortable with in terms of the maybe the magnitude of who's being left behind. In particular, in this case, children and indigenous women, which you captured. So wonderful. Let's see, what else do other people have comments on? I see children again here. Yep, the 100%, someone else caught that. Sex differences among indigenous people. Yep, so we see sex differentials between both ethnicities as well. Let's see. Yeah, indigenous people's registration. Yeah, we see that that's lower. Okay, great. So again, in this exercise, there isn't necessarily a right or wrong answers, but I think everyone has done a pretty good job of, in just a key bullet point, summarizing some of the issues that you saw. So I did this green one here. Let me see if I can make it bigger. And I apologize because these sticky notes are not quite as, can't quite manipulate them as well as you would like to. But so my first comment here, my first bullet, I wrote, children under age 1 are the least likely to have their deaths registered, especially indigenous children. Just 1 in 3 indigenous children infants have their deaths registered compared to, and I made up this number here, it's not in your table, but 90% of the adult population. And then my second point was Indigenous women are the most under-registered adult group. And then my third one was, let me see if I can make it bigger so I can read it better. Indigenous males and females have lower rates of registration across all age groups compared to their Marsian counterparts. So something is going on with ethnicity. Okay, so now what we are going to do, based on, we had some key findings. And then if we go back to our exercise again, hopefully you can, oops, I'm not on the right one here. There we go. If we go down to the second part now, so the next exercise is to write 3 bullet points while each of the above is important. So why does it matter that children are under-registered, or why does it matter that one ethnicity has higher registration than the other, or why does it matter that males have, women have lower registration than males? So whatever you wrote for 1, 2, and 3 above, now just write 1 bullet point of why we should care, why does this matter, why is it important? And then when you have a chance, post your sticky to the Jamboard, and we'll go to the Jamboard slide number 14. And that will give you another, say, 10 minutes or so to do that. And is there a question, or is the hand raised from the slide from before? Our colleague from Rajasthan, okay, he's good. I think it's from his sticky before. Okay, great. So give yourself a few minutes to think about and write a few bullet points, and we'll circle back. maybe if everyone wants to take about one more minute, it's okay if you don't have all three. If you even just want to put one on a sticky note, that's great. So we can have an idea about everybody, what they're kind of thinking about the importance of this data. Okay, I see. So several different angles or viewpoints coming in. So, we care about the differentials to have a better assessment and health coverage for especially these Indigenous populations or infants. Let's see here. Yeah. I'm not the person who just put this yellow one right here. This is a good, interesting one. Do you maybe want to unmute and say why you mentioned this one? No pressure, but if you're willing to, whoever wrote this one right here, that would be great if you want to share your thoughts. What about this yellow one right here? Would this person maybe want to share their thoughts?
Yes, ma'am. That's me. Ma'am, can you hear me?
Yes, go ahead.
Yes, ma'am. Actually, what I'm saying is, if there's less registration of deaths below 1 year, all health figures of infant mortality rate will be skewed. So the policy formulations which are made to overall improve the infant mortality rate will be giving wrong formulations, because the basis or the foundation of the registration itself is not there. So I believe that that should be taken care. The second one, indigenous population is in the overall database of the government. So the foundation for their population development or the health status will also be poorly reflected if the foundation for collection of those data or the registration is not happening. That's what I meant.
Absolutely. And let me ask you a further question. So you're right. If it's not complete, the IMR will be too low, right? It won't be correct. But why do we care about IMR?
IMR is a vital health indicator. It is part of our SDG as well, UN SDG as well. And also it is a vital indicator for the overall human development index of the country. Because once the infant mortality deaths are happening, that also means that people reproduce more and more.
Right,
and
right.
the
So
life expectancy will come down, the child nutrition will come down, and so on.
yeah, absolutely. So I was just trying to get you to go the next step. So right, so we care about IMR because we want to monitor the health of infants, right? And so we want to know about infant and mother's mortality and to improve the health going on, right? So just taking it like you have the nail on the head, but taking it one more step. So exactly. So perfect. Thank you. Thank you for your comments. It's very helpful. Anything else you wanted to add?
Ma'am, one more point is there that 25 to 29 female indigenous deaths are very less registered in this as per the graph. I'm not able to get the correct understanding of that, but I'm guessing that it is because the maternal are also not being registered in indigenous. That's why the death registration is low. Is that why the registration is low for indigenous female deaths from the age of 25 to 29? That's a question.
Oh, so you see a little dip in 25 to 29, right? I honestly I wouldn't read into it too much. What I would want to do is look over time for each year, and if you consistently see that dip, then you might be concerned and you might worried about maternal mortality, right? Or something's going on with these females. But it could just be kind of a little bit of a stochastic variation in the data. And again, because we're disaggregating on many levels, maybe our data quality isn't super strong to look too much. But you're right that it is an interesting dip, and it could be indicative of maternal mortality or something else going on, which we would want to investigate. So that's a good question and a good point. So his comment was about the graph. You can see the dip in the 25 to 29-year-old Indigenous females. So it's lower, registration is lower in that age group. Actually, if it's lower, well, I guess we have to ask why. Why is it lower? And so we're not sure. We would want to investigate that a little bit further. I was thinking about it being higher. I was thinking the other way around in maternal mortality. But yeah, I wouldn't read into this too much. I would want other years of data to kind of understand by each age group. But yes, good point. Any other comments or thoughts? How are we looking on our journal? Okay, we have a lot more post-its going on.
Ma'am, may I make a point, ma'am?
Yes,
Ma'am,
please.
this is about the maternal mortality of the indigenous females, ma'am.
Mm-hmm.
Because maternal mortality is again associated with there's so many health services associated with the mother and mother health or maternal health, ma'am. Starting from prenatal services to postnatal services, the nutrition, the economic condition of the female belonging to what family or what economic group, they're all in fact joined together. They decide how healthy the female or her reproductive health can be, ma'am. Unless until the mortalities are registered, the incidences of mortality are traced, and the reasons are found, it won't be possible for us to know the exact reasons and to find out the corrective action. So that's why the low registration of indigenous maternal mortalities would be difficult for the policymakers to in fact find out the reasons and to set the things right in future days.
Yeah, exactly. And if you don't know how many women are dying at what age and what from for maternal mortality, for example, then you can't put in place those services in your clinic to save their lives in the future, right? And so it's very important to know, if the death registration is too low, especially in that age group, you won't capture those deaths to improve things in the future. So it is critical to have that information, absolutely. And I think that's a really important point that you make, that you can use that as an advocacy point when you're writing your policy brief, right? To say the importance of this data. So absolutely, that's a very good and critical point. Thank you for that.
Thank you, ma'am.
Yeah. Any other thoughts or comments you'd like to add?
I was I'm wondering about the table. If somebody is made to make a guess about the life expectancy, because we are finding a lot of people, dying after 85, in fact 90 also. So can we make an assumption that the life expectancy of Popula India is really good? It is very positive.
Oh, so what your question is about these older age groups here, yes? Is that
Yes,
your
ma'am.
okay? So I didn't tell you the life expectancy of Poplandia. I didn't really factor that in. But even let's say the life expectancy was only 60. That doesn't mean that everyone will die before 60, right? It means that some will die at 40 and some will die at 80 and some will die at 90. And these aren't absolute counts of deaths. These are the percent completeness. So it's quite possible that you only have, say, 10 deaths that were registered and then over, say, 10 deaths that were recorded or whatnot. This is roughly what, 70%. So let's say that you have 7 recorded deaths and 10 or 7 registered and 10 recorded deaths, and that would give you 70% completeness versus this could be 10,000 deaths, more deaths at this age group. So this particular graph right here doesn't really inform us about mortality trends by age. All of this is looking at is completeness. So we can't really tell anything about our population structure, if it's an old population, a young population, if they're very healthy, if they're not healthy. It doesn't tell us anything. All we're really looking at is who's registering their deaths. And we can see the Marsians are better at that, and especially adults compared to the Indigenous population. So unfortunately, we would need more information and more data to understand the health and mortality situation of the population. And that's a bit outside the scope of this particular workshop, but there's other, I think, if perhaps there's some links that Panita or other colleagues could put in the chat. I think there's been recent workshops on demographic analysis where you could look at more estimates of mortality, which you might want to go have a look at, and that might be helpful. Does that answer your question?
Yes, ma'am. Thank you
Okay.
very much.
Perfect. Sorry, you put that in the chat box and I forgot. I missed that and to come back to it. So thank you for asking again. Any other comments or questions? Okay, so, go ahead. Did someone have one? No, okay. So looking at we have lots of sticky notes. We have lots of different angles in terms of how we can engage the policymaker and interest them. Mine, again, are these blue ones over here. And so again, the first one was relative to infants. And I just said, if we don't capture the full extent of infant mortality, we cannot know how many children are dying and what they are dying from in order to prevent future similar deaths. We will not be able to improve the health, and I think it was supposed to be of infants, but it got cut off, so apologies. The second one was about the Indigenous women. So I said women and men die of different causes, and without complete death data for women, especially Indigenous women who, and then I just kind of made something up, experience increased rates of non-communicable diseases such as diabetes. Oh, it looks like mine was a little too long for the sticky note. I can show you the Word document in a minute, maybe that'd be helpful. And then the final one was about the difference in ethnicity. So we cannot improve the higher mortality rates we see in the Indigenous population without complete death registration data. It is important to bridge this gap so we can monitor the effectiveness of public health interventions. Okay, so let me show you. I also will put my suggested summaries in the solutions folder so you can go back and have a look as well. But let's go back to our exercise again. And let me maybe pull up the one actually that has the solutions here. Oh, I think I'm sharing the wrong one. Okay. Well, that's okay. I can just save it to the folder for you anyway. So, and then we'll keep moving on with our exercise. So, our next step is so we said what our key findings were, we said why they matter, and now we need to write recommendations to improve these. So if our key finding number 1 was about under 1 deaths being low, what do we need to, what kind of suggestion would you say to improve this? And you can use some liberties here and make some assumptions about the country or make something up, or you can think about your own country, what would make sense to improve infant deaths. So if you can only have one intervention, what would it be to improve infant deaths, assuming that was your key point number 1? And so think about, the policy recommendations for each of your key points. And then maybe if there's any critical areas of future research that you really think need to be investigated, you can think about that as well. So let's take 10 minutes to write up our policy recommendations, and then when you get a chance, you can put them on a sticky note on the Jamboard, and we'll move on to the next Jamboard slide. I see one of our colleagues has their hand raised. Do you want to ask a question or have a comment? Alungar, if you do want to, if you have a question or comment, do feel free to speak. I'm not sure if it was an accidental hand raise or if.
Sorry, I cannot get the chat option here. It is off for me. So
Oh,
I
the
cannot.
chat. Oh, I'm sorry. Okay. Did you have a question or a comment? Or just about the chat?
I just need the Jamboard link so that I
Okay.
can comment there.
Okay, great. Maybe Panita can email you the link if the chat is not working for you. Or maybe you can also try to leave the meeting and rejoin and see if it shows up again.
Okay.
Okay, great. I see some results coming in, different comments in terms of recommendations. So I saw one I liked. I was hoping, let me find it. Where did it go? This yellow one right here. Whoever submitted this, would you like to comment on your thoughts on this one?
Ma'am, that is my comment.
Okay, go ahead.
Ma'am, what I meant was because it would suggest that if the institutional births are happening, that should be registration offices, CROs, so that we can increase the registration and the death registration completeness can be increased. And also, if they are not institutional births, then IEC campaign to increase the if it is happening non-institutional deaths. The second recommendation was of indigenous. Those 2 points are added.
You were cutting out a little bit at the end. Can you maybe summarize again what you just said at the second point?
And second point, what I was saying is to increase the indigenous registration, indigenous population death registration. So my suggestion was to establish more civil registration offices in the indigenous majority areas because they are generally remote and inaccessible.
Yep.
Apart from the IEC campus, which I mentioned earlier.
Perfect. So these are very clear, very simple, straightforward recommendations to, and this is what we're getting at, right? So you know, you based on your key findings, you have your key recommendations. So wonderful. Thank you very much. Any other comments you want to add?
That's all. That's all.
Okay, great. Thank you very much for sharing. Any other volunteers before maybe I pick another sticky note? Anybody? How about this one right here? Maybe the person who wrote this, would you like to comment?
Yeah. Okay. Yeah. Thank you, ma'am. That's me.
Okay, go ahead.
Yeah. The decentralization of CROs and health services, especially for pre and postnatal, since we have a very Paplandia has a very low record of deaths in that area, in that category of births. My suggestion is to take those clinics out to them, so that it will be easier for them to have easy access when they come for births and the registration of their deaths as well. And also to looking at the records of the participation in from the Paplandia indigenous community, it's very low. So my another suggestion is for the advocates from the community to help them be advised and be made aware of the importance of recording the deaths. Thank you.
Thank you. Yes, exactly. So, you know, based on your key findings, these are excellent recommendations, very clear and very straightforward points for this. So thank you for sharing your thoughts on that. Why don't I pick one more? Maybe the person who wrote the blue one right here. Do you want to share your thoughts or comments?
Yes, I wrote that one. My question is maybe there are some embargo or social norms which is hindering the female indigenous people to be registered in the process. So there should be some special program or awareness program among the female among the indigenous people, so that they can they get more access to the registration system.
Great. And so, yeah, that's you know, if you maybe you know that there's a differential, there's something going on, but maybe you don't know why. And so a good recommendation is to do more investigation to understand what's going on in order to support future changes in the going forward, right? So excellent. Thank you very much for sharing. Any other volunteers want to share their thoughts on recommendations? If not, I will, I'm going to just quickly share my summaries, and then we're going to go to the super fun part. Okay, so I just, I kind of took some liberties with Papulandia and the situation. So I said a regulation should be enacted to require health facilities to report all deaths to the civil registry offices. Electronic linkages through databases should be the ultimate goal to capture deaths least likely to be registered, such as infant deaths. And then the second one was about the differential in ethnicities. So I said awareness and targeted campaigns for Indigenous populations are needed to improve registration, especially among Indigenous women. And then finally, this is about access and the geographical issue. So civil registry offices should be located in every town with a population of, and I just use the number 20,000 or more. Increase mobile registration to service those populations more than 10 kilometers from a civil registration office. So you might not be able to make a recommendation like this at the very beginning of your inequality assessment, but perhaps as time progresses, maybe you can think about more specific metrics or whatnot to improve registration. So let's go to the final piece of this. Let me share the one that I don't have my comments on really quick. Sorry about this. Okay. So we just wrote up our policy recommendations and maybe if there was any research we needed to be done. So the final part of this, you know, based in reality, we have limited resources, limited funding. So let's say that we can only pick one key issue. And so think about what key point you would focus on. And again, there's no right or wrong answers here, but just pick one of your key issues. And so, you know, using one of the three from the points above, what I'd like you to do is write 3 to 5 sentences to summarize what the main issue is, why it matters, what is your recommendation, and if there's any maybe future research that needs to be done. And so you've essentially already done this because you've had your sticky note with your bullet points, but now I'd like you to think about how to write it in a paragraph. So complete sentences, you know, only 3 to 5. You don't have to, you know, write a whole page or anything. But think about how you would write a paragraph to summarize this all together. Just pick one of your key issues. So I don't think that the paragraph is going to fit on the sticky note. So what we could do instead is, here, let me share the Jamboard with you really quick. So if we get, we'll go to the next, this one right here. So if instead of going to the sticky note, if you want to go to this little text box down here, and then you can, I think you can paste basically, you know, unlimited text here. And then we will, I think you can format it so it's maybe like a caption size, and we can do something like this. Maybe we can have like little paragraph boxes or something. Otherwise, maybe we can also share our screens if you have it on a Word document and you want to share, but let's try to use this little text box and see how far we can get with that. So I realize that writing complete sentences and putting it all into a paragraph can be a little bit more challenging. So maybe what I'm suggesting we do is this take 15 minutes, but we'll build in part of our break to this. So, you know, take a short, maybe 5-minute break, and then also work on your paragraphs. And then I think over the break, if I understood, Panita would also like to share the evaluation for this workshop with you. I think she'll post a link and maybe put a QR code up. Panita or Sharita, did you want to comment on that?
Yes, yes, thanks, Renee. So this is Vanita will just put the QR code here. Yeah, Vanita will just put the QR. Yes, thanks, Renee. Vanita will just put the QR code for the evaluation. We just request you to take 5 or 10 minutes of your time to just give us your thoughts on how things went and what can be done better so that for the future we could make appropriate improvements in such workshops. As we said on the first day, we're doing this whole thing virtually, and this is actually a training. And in a virtual setting, it's not very easy to run these training programs. So your feedback here would be much appreciated. So here's the QR code on the screen, or you can click the link below. And during this break, if you could just spend a few minutes reflecting on this and submitting it, we will be very grateful. Thank you so much.
Thanks, colleagues. So why don't we take about a 15-minute break and we can reconvene, say like 2 past the hour, give or take, or around the hour, and we'll circle back. And I will leave the evaluation QR code up. I won't share my screen with the Jamboard, but once you have your paragraph, feel free to paste in the text on the Jamboard and we can circle back after the break. Okay, colleagues, I see a few of you have posted your paragraphs or sentences. Do you need a few more minutes, the rest of you? How is it going with this? Maybe if you do need a few more minutes, post in the chat box roughly how long you need, or if you're ready, maybe just post that as well. Well, we can keep moving. I only see one paragraph, so I'm wondering, well, I know the sticky note's a bit challenging. You might have to use the text box. So this one right here, this little guy is the text box. If you need to have a little bit more space, because the sticky note will cut off the number of words. So for those of you who have the sticky note, I'm wondering if I can challenge you to make these into sentences and to write a paragraph. So this is what our ultimate goal was, is to use our 3 bullet points from before and craft it into one complete kind of coherent paragraph. So I see 2 paragraphs so far, and the rest are still more kind of bullet points. So maybe if I can challenge you to take another minute or two, are you able to make your sticky notes or your bullet points into a paragraph? So think about if you were to write something that you were actually going to put on the desk of a policymaker in a paragraph, what would you want to say? How would it look? Okay, so we have some more responses coming in, which is great. Does anybody want to volunteer to read their sentences? I'm also happy to pick a few. We don't have any volunteers. I'm wondering if TR, I'm not sure who that is, but if you have a series of them here, which is great. Do you want to volunteer to read them and maybe talk a little bit about your thoughts? Do we know who TR is? Maybe TR is feeling shy. No worries. If they want to come back, please feel free to raise your hand or let me know. I will volunteer another one. Let's see here. Okay, the one that's being circled right now, this TKM. Do you want to read your sentences and tell us a little bit about your thoughts?
Yeah, sure. Good time of the day to all of you. I hope I'm audible. So, in order to raise the data completeness, the government has to raise the awareness of population to be involved for data completeness. So, when you organize maybe some workshop as we have today, then it somehow will at least raise a little level of awareness among population, both among Indigenous and Marsmen, as we used to say them. Like we usually used to say aliens. So then to have the full picture of any civil status, let it be birth, death, divorce, or maybe marriage, the further analysis has to be performed. Like when we have these rates that are below the average or above the 100%, so this is exactly where the issue appears and the further analysis is required. The third, what we mentioned is it is important to have more CROs in urban and rural areas, regardless of the distance, as you mentioned, in 10 kilometers. If the population number requires more, like more CROs, not in 10 kilometers, maybe in 5 kilometers, and as it was mentioned in the previous slides, there was a comment on online registration. This is also good. Like, regardless whether you have these civil registry offices, you can access them online. That will be really great. And the last one, the government has to organize the data cooperation centers. Like, this is something what comes to the mind, where all data will be collected from all the policymakers like Minister of Health, Minister of Education, civil register offices, and maybe statistics office that will provide the data, where all data will be collected and summarized. So, and like this will be one step further that will provide more exact data that could be later used. I hope I was clear. Thank you.
Yes, that was perfectly clear and most excellently stated. Thank you for sharing. So, you know, as she mentioned, she was talking about awareness, and that might be particularly important for the Indigenous population in our particular example. And then to have more civil registration offices in terms of the access, and then cooperation, which will be important for the data sharing and analysis. So all of these things are a very excellent point and very well worded. Thank you. Just a note on my exercise, because I had to, you know, there hasn't really been a lot of countries that have done inequality assessments. So I kind of had to make up the data and make up the country. So our fictional country of Poplandia, I didn't really think about that, but Marsians does kind of imply that they're aliens. I didn't intend it to be that way. I was just trying to think of another name of the ethnicity that could possibly be there. So apologies if that was confusing, but I could see how it would be interpreted that way. So thank you very much for sharing your example and this excellent write-up. Does anybody else want to volunteer before I choose another volunteer? Oh, I see. TR is Turkey. They couldn't connect. Are you able to connect now? If you are, please, we would love for you to read your summary. But if not, no worries if your microphone is not working at the moment. Let's see here. What about this summary right here? Does the person who submitted this one want to read it and give a little bit of background? No volunteers for this one. Okay, what about this summary right here? Does the person who submitted this feel comfortable reading it and giving their thoughts?
Yeah, thank you. Yeah, that's me, ma'am.
Okay, go ahead.
The main issue is the incomplete birth registration of infants and the indigenous community. This is an important component for further studies, as we have discussed earlier in our exercises. To have a complete birth registration will paint a picture of the actual situations that the entire population is facing, and also it will also reflect and highlight the situations faced by the subpopulations of the entire population. In our case, for Poplandia, it will reflect for both the ethnic groups that are there, for the Indigenous and the Marsians. The recommendation is to decentralize the CROs and the health services to the remote areas of Poplandia. Having those CROs and the health services in the remote areas will have manpower in those areas, and will also enable the workers or the advocates in those areas to visit those communities and educate them on the importance of registering the deaths and births as well in that case, for especially the issues that you are facing with the infants. Having those people in those having those services brought to them will also make it easier for them to have access, and will also enable the workers to educate the people on the importance of registering their births. And secondly, the second recommendation is to have a linkage between those two offices, where whenever deaths are recorded in the Ministry, in the Health Service, to the Ministry of Health, it can be also reflected in the CRO offices. And for future research, in my opinion, future research is needed on the situation faced by the indigenous communities of Papulandia, since for recording purposes, they are not well part of compared to Margins. So further studies need to be conducted on what could be the reason for such situations of non-respondents to the registration by the indigenous community. Thank you, ma'am.
Thank you. That was a very excellent summary and very comprehensive. So much appreciated. So the main issue he chose was that the low infant registration, and then discussing the need for access and going out into the community and making sure that there's civil registry offices as well as health services, and the linkages between the different departments, as well as the future research needed to better understand maybe the challenges or barriers in the indigenous communities. So excellent. Thank you very much for that summary and sharing your thoughts. Any other volunteers? Do we want to try to unmute Turkey? Panita, it seems like, is it on our end?
Yeah. I also don't know why it doesn't work.
Their line doesn't work. It's not working.
Yes, yeah. Even I allow their microphone, it still doesn't working. Yeah.
Okay. Okay. Well, maybe in the interest of time, actually, what we'll do is we can go to kind of my suggested summary, and then we can go on to the next lecture, because I know that there's a few things we still need to cover today. So let's go to summarize this exercise. Oh, actually, while I'm pulling this up, I have a question for everybody. So I'm a bit curious if, you know, I see a few people did paragraphs, and a few people kind of did bullet points or whatnot, and so I'm just kind of curious how challenging you find writing for policy. So I'm going to put a little poll up here. Maybe hopefully it'll show up in a minute. Here we go. So it should pop up on the screen and then also in the chat box. And I'm wondering, how challenging did you find writing up the results for policy? So for this example, did you find it not challenging at all? Maybe you do it all the time for your job. Was it moderately challenging, or do you find this kind of thing very challenging? Perhaps it's hard to go from, you know, thinking about data into actually summarizing very succinctly and clearly and briefly. So I'm curious kind of where everyone's at in terms of this exercise. Okay, so while you're voting, I'm also going to go over, let's see here, quickly my summary for you know, my paragraph for the policymaker. So I actually chose the differential between the indigenous population as my focus, because in my mind, that would have the greatest impact in terms of the number of deaths to be registered. So infants are definitely important, but if I was looking holistically and trying to improve the registration, in my mind, I was thinking maybe you know, really focusing on narrowing that gap would make the biggest improvement. So what I wrote is the indigenous population suffers disproportionately from, and I, you know, just kind of taking some liberties here and making this up, but saying non-communicable diseases such as heart disease and diabetes, However, death registration completeness is lower across all age groups in the Indigenous population compared to their Marxium counterparts. So I was trying to set the stage and say, you know, hey, policymakers, here's why you should care. We know that there's these public health problems in the Indigenous community. However, we don't have death registration data for them. It's not as good as this other group of people. And it's important because death registration data is critical for monitoring the effectiveness of public health programs and policies to improve the differentials in mortality seen in the Indigenous population and to inform interventions to prevent similar deaths in the future. Without this data, we cannot effectively improve the health situations of Indigenous communities. So this is kind of stating the problem and why it's important. So next is the recommendation. And I have this little figure here so they can see as well. As much as 80% of the Indigenous communities live in remote areas, many of which are more than 20 kilometers from civil registration centers. Greater access to civil registration centers is critically needed. Provinces with no registration offices, such as the Eastern Province and Eastern Isle, should be prioritized for increased access. Further, village chiefs and Indigenous communities should be engaged to support and awareness raising and planning of institutional civil registration offices. A dedicated budget towards funding awareness campaigns and mobile outreach to improve death registration within the Indigenous community should be considered to increase registration in the interim. So I realize mine is a little bit more than 3 to 5 sentences, and it's a little bit long, and but I was just trying to give an example of setting the stage of here's a situation, here's what we found, why it's important, and here's our recommendation to improve it. So I will make sure that this is saved to the solutions folder, and then I'm also going to save exercise 9, even though we're not going to do it today. At least you can see it as an example talking about birth registration and maybe some key points to think about or to bring up. Anybody have any comments or questions before we go on? Okay, so I'm looking at our poll here, and I don't think everyone has voted. We only have 9 responses, but most people found it moderately challenging. So it wasn't, you know, one person said not challenging, one person said very. So most people are kind of in the moderate range. I'll be honest, I find writing challenging. I am a statistician. I love data. I love making graphs and that kind of thing, bullet points. Writing long reports, not quite as much. So I'm kind of just curious to see how the rest of the group, where they fall. So if you haven't, please take a chance to vote, and then we'll keep going on. So our next lecture is going to be talking about the technical report, writing up our findings. So I think in the interest of time, we probably won't go into all the detail on all of the slides because we have a few things to cover. And then I think Sharita wanted to do a little bit of discussion and checking in with you at the end as well. So we'll just kind of briefly cover this. And then if you want to refer to this slide, perhaps in more detail, if you down the road when you are going to do a technical report, they'll be on the website for you to access as a resource. So we just discussed the policy brief and the importance of keeping it brief, under 1 page, etc., not too technical. But the technical report is a good place where people can get more detail and information. And if they're particularly interested in, say, one certain population or component, they can go there and they can read more. And we want to make sure that we include enough details that down the road, the inequality assessment could be repeated. Say that there's turnover in the office, or you get a new job, you get promoted and someone else comes in. Are they going to be able to replicate the exercise in 5 to 7 years? So we want to make sure that there's enough information somewhere for that people can do it in case the historical knowledge gets lost. You know, we have these different components of the technical report. We'll go over each of them briefly, starting with the executive summary. We want to keep this brief similar to the policy brief, but it can be a little bit more technical than you might write for a policymaker. So you can go a little bit more in depth. you still want to make sure you include the background, the methodology, at least at a high level, your results, and then your recommendations, but try to keep it brief and summarized, 1 to 2 pages. Your table of contents, I think, is pretty self-explanatory. But some things to consider in your background or maybe your introduction section is, why did you undertake the inequality assessment, and why is it important for your country? So kind of set the scene. Maybe if there was any other previous work done, even if it was perhaps a household survey like a DHS or a mix that kind of analyzed this. Has anyone done any interventions based on the data? And then just kind of explain the situation of civil registration in general in the country. How complete is the data? How well is the system functioning? Are there any relevant initiatives that will either impact or perhaps be impacted by the findings of your inequality assessment? And then maybe if there were any specific goals in relation to CRVS for the SDGs or for the ESCAP regional action framework, or maybe CRVS is a priority in your national development plan or your national statistical strategy or other line ministry plans, it's important to mention those and kind of set the scene for the country. In your methodology, it's important to include who the main stakeholders are. So usually the core group is the statistical office, the civil registry, the Ministry of Health, but sometimes there's other key players. And, if you got data from other line ministries, such as Ministry of Education, or there was an IT department that helped you with linkages to other databases, maybe Ministry of Social Development, et cetera, it's important to include the different persons and their roles in the project. Mention your desk review, list who you did interviews with, what kind of data did you inquire about, what were your findings in terms of that data, what variables did they collect, what did they not collect, what kind of subpopulations did they collect for. At the end of the day, when you received data, did you get it in unit record form or pre-tabulated? Were there any variables that you had to recode or derive by yourself, and how did you do those? Include any unknowns if there were any variables that maybe were not clearly defined, or maybe they had an unknown source. And then, of course, it's very important to document what was and wasn't available and wasn't usable. And part of that will also come into your findings section. And then once you review the data, also make sure to mention any data quality issues, if there were a lot of missing records, if you had to do any adjustment or any recoding. These are all very important things to put in your methodology section and explain how you did them. And then if you had to develop any proxies or do any adjustments, these are also very important. So if you had some assumptions that you made in your proxies, make sure to document them here. If for some reason your numerator and your denominator, the metadata or the definitions didn't 100% align, but they were close, this, similar to a proxy, kind of, obviously mention that, but also what were the assumptions and maybe how could this affect the results? And if you have data over time, or if you're looking at a certain type of data, if you see any aberrant trends or something that looks strange or unusual, you should address them in your methodology. If they can be explained, make sure to document that. And if they can't be, then to mention that there's potential concerns for data quality issues in some of the points. And then also mention if anything requires further investigation. So you obviously want to talk about the years that you examined, your methods for the registration period. It's particularly when we talked about the delay. Did you do registry within a year, within your legal time frame of, say, 1 week or 30 days? How did you do your calculations and pull your data from databases? And again, if anything got changed, if anything doesn't quite align between the numerator and denominator, explain what it is and why, and anything that might impact your final outcome and interpretations. So I mentioned before, we want to make sure there's enough detail that the assessment could be duplicated. So even if this doesn't end up in the report, or maybe it doesn't end up in the methodology, having it in an annex, or even having some kind of documentation in your office, we just want to make sure that we maintain the institutional knowledge so that if people move on to other opportunities, or new staff comes in, or there's new new actors in the game, that we make sure that we are able to replicate it. We don't want to start from scratch or first square one. And so in that way, it's helpful to nominate one of the leading institutions to be the archivist and to maintain that documentation about how the assessment was done. Especially if for whatever reason, maybe the data or the methodology or whatnot is sensitive, or if you have it very well detailed and documented, it's too long for a report. We just want to make sure that we do have it on hand somewhere. So for your results, of course, you want to discuss your main findings. If you have other sources you can compare them to, especially for the same period, do they all triangulate towards the same values? Are they different? Do they point to different conclusions? What do your findings mean and why they're important, which is what we did similar to the policy brief exercise we just did, but we also want to make sure we include that in our report. And then what are the implications of our findings, maybe on a high level, because in the discussion we can go into more detail in terms of our recommendations. And then if anything was unclear or anything was looking a little bit unstrange, and also to document maybe what wasn't available, or kind of your findings. This is also important to put it in the results section. And then any time that you can, clear, simple graphs are helpful for the reader to understand your results. And then in your discussion, if you can include what your main findings were and what they meant, why they're important, the implications for policy, and then of course your recommendations. So these are critical that they make it in there. You don't want to go through this whole exercise doing all the analysis, even writing up a report with your results, and then have it just sit there and never be used, and not used to inform any kind of intervention to improve the registration of those most marginalized populations. So remember, you are the expert. Don't be afraid to include recommendations in the report. So again, if there's any trends you see over time, even if it's stagnation, nothing's really changing, that's important to include. And then also mention what areas require further investigation or research in the future. We've talked about this a lot. Document what data needs to be collected, maybe what's missing, what could easily be changed, and what actors might be involved. And then, your conclusion or just your key takeaways, again, your key findings, implications and recommendations, important considerations for future improvement, and importance of assessment for your country. Like, what did doing the inequality assessment mean for your country? What implications might it have for the future? And your annexes, if you have any really long detailed tables, or your methodology gets really long, or you have a very detailed index of perhaps the data you looked at and analyzed, and if it was good or bad or quality or whatnot, this is a very good place to have that so readers can reference it. And then, of course, your bibliography, if you've made any references throughout the report or citations in your text. I'm going to go through the next lecture. We have a few more minutes pretty quickly, and then we can circle back for questions and have a little end discussion. So at the beginning of the day, one of the colleagues asked, how often should we do an inequality assessment? And so this is discussing planning, say, for the next inequality assessment after you do your first one, and trying to set up a reinforcing feedback cycle and institutionalizing inequality assessments so they become a regular part of work and that they're more sustainable. We talked about we really want to make sure that they inform policy change and action, and so part of that is kind of setting up this cycle and institutionalizing inequality assessments. And I showed you the high-level roadmap on day one. And so one of the key points is that it is a loop. And if you monitor your improvement from interventions, to do the inequality assessment again and see where you're at in, say, 5 to 7 years' time. So it's really critical that after the first assessment, you have a discussion to understand what could be done to better investigate inequalities in the future, and what might need to happen to do an even more in-depth or more rigorous assessment, say in 5 to 7 years' time. So if your existing data sources, if they're not being sufficiently exploited, what might need to happen in order to use them to their full potential? And your findings from your first assessment are critical for planning the follow-up assessments, because especially for those populations with no information, just to consider the data collectors, maybe how they can better disaggregate the data, or even what additional data needs to be collected. So for example, if your registry office is only collecting 2 ethnicity fields, but you really need 4, perhaps that's just a simple way to further disaggregate data that's already being collected. But if they're not collecting ethnicity at all, then that might be a little bit bigger plan or bigger exercise in the future going forward. Once we know who is being left out of data collection, which is why it's important to document it, like we said, that's a policy implication in and of itself, and so we want to make sure that we advocate for better data collection. So it's helpful if after we do our assessment, we make some recommendations, perhaps some interventions get put in place that we can monitor how well those interventions are improving registration of marginalized populations. So, throughout some of our examples, we said we wanted 90% of the population within 10 kilometers of a registry office, just as an example. So one of our indicators could be the percent of a population within a certain distance of a registry office, or maybe it's just something simple like the number of mobile campaigns to a certain subpopulation in a year. Maybe we aim for 2 or 3. Did we meet that metric each year? So you would want to set up a time frame, say maybe 5 to 7 years for your next assessment, and develop a basic roadmap towards planning that. And so here's, I know the text is a bit small, but so if you start off at present, you identify who is left behind, and then say in 1 to 2 years, part of your assessment was who doesn't have data collection. And maybe in 1 to 2 years, you can start to improve that collection. You can strengthen the coordination between the different ministries so that data sharing also gets strengthened. So let's say maybe 3 years' time, you might have more good disaggregated data. Maybe in 4 years, your committee meets again to start talking about the next inequality assessment. In 5 years, the data is reviewed and analyzed. You compare the results to the previous assessment, make recommendations based on what's improved, what hasn't improved, maybe some new findings, put in place some interventions in, say, year 6 or 7. And then you might start thinking again in a few years about the next assessment. So this is kind of a rough timeline, but the idea is a reinforcing cycle. How can we make inequality assessments sustainable? So we need to consider ways that we can institutionalize them, such as including them in a national statistical development strategy, and including things like data analysis and data collection and perhaps timelines for publication in such strategies. And similarly, perhaps if we have a national CRVS improvement plan, in that plan we can incorporate having an inequality assessment, at least once every 5 years, depending on the length of our plan. We might not be able to include more than one if our CRVS plan is only 5 years, for example. But if we can include them in some of these other plans and strategies, that can help make inequality assessments more sustainable over time as they become institutionalized. So kind of as a summary, you know, I keep saying you don't want to do all this hard work and just have it sit there, just have it be a report with results, but no actual recommendations or policy implications. So it's really important that we make sure the data is used. And similarly, we want to make sure that the lessons learned from doing the first assessment can lay the groundwork for the next assessment. And then we start thinking about this while all this is fresh in our mind. And so we want to build a framework for follow-up assessments so that they're resilient enough, as I mentioned, to withstand, say, staff turnover, and we can kind of have an institutional memory about how it was performed so that we can go forward in the future. And of course, we want to document even what we don't know because that has important implications. And we want to look for ways to institutionalize inequality assessments as best as possible to make them more sustainable and ongoing. So we'll pause there. We have about 15 minutes left, and I want to check in and see if there's maybe any comments or questions on the last few lectures. I know we went through them pretty quickly. As I mentioned, they'll be on the website for reference as well in the future as a resource. Go ahead. I see a hand raised from our colleague in India.
Ma'am, can you hear me?
Yes.
Ma'am, I have one doubt regarding the inequality assessments. Who are the ones who are supposed to do inequality assessment? Because the census or the collection of statistics is generally done by National Statistical Organization or Registrar General. But should it be done by the same agency or should we need a third-party agency? If we need a third-party agency, is it generally an NGO which does it, or an international agency, or an academic institution? If you throw some light on that, and how is that acceptable to the general government per se? If the third party is doing it, whether it is acceptable to the government in countries where it is already done. Thank you.
So I think your question is who should be involved in an inequality assessment? I'm not sure if I caught all of what you were saying.
Oh, no, who should actually do the inequality assessment? Who is the in charge for doing the inequality assessment? Because the civil registration is collected by the Registrar General. So who is the one who is actually showcasing the shortcoming? Basically, inequality is basically saying that who are the omissions, what are the omissions which are there. So who is that person who is in charge of pointing out and showing the inequality assessment to the Registrar General? Thank you.
Okay. So who's kind of leading them? And it really needs to be a partnership, a strong partnership between the Civil Registry, the National Statistical Office, and the Ministry of Health. And I mean, in general, a lot of the times anything with analysis, statistical analysis kind of falls on the National Statistical Office. But again, it can't just be them. It really does need to be a strong partnership. Because you know, it involves all those parties and they all play a very key role.
Who generally leads that partnership, ma'am?
Well, I mean, we can't really say generally because most countries, I mean, there aren't really any countries that have done an inequality assessment, unfortunately. But I would say, generally speaking, for these types of things, it is the National Statistical Office. But again, they can't be doing it by themselves. They can't be the sole champion. It really does need to be a partnership. Yeah.
Thank you.
I don't know, Sharita, if you have any comments on that or any thoughts on that question.
Yes, thanks, Renee, and thanks for the question from the colleague from India. I think a lot of confusion lies in the word assessment, because when people hear the word assessment, it often sounds to them like there should be a third party or a neutral body coming in and conducting such an assessment. At the UN, we often try to avoid the use of the word assessment for this reason, because it kind of scares people and they think it's something which is extremely formal. There's going to be this body that's coming and auditing us and assessing us on something. And that's why over the years, we've tried to avoid using this word a lot. But in this scenario, what we mean by, even though we're calling it an inequality assessment, we're really not, this is really not about putting the system to test, or shaming the system for not including certain groups, or shaming and naming some countries or things like that. This is really for addressing the issue of leaving no one behind. It's basically an internal issue to the country. You don't have to showcase this to the world. It's not about, it's good for you to tell the world that you are able to achieve that 100% completeness when it comes to your birth and death registration. Yes, and in order to achieve that, you also need to ensure that you have included all those groups that could have possibly been missed out or are marginalized for some reason, or whose existence you just do not know about. So it's very much the way we see it. It's very much an internal exercise, whereas Renee pointed out a good partnership between the National Statistical Office, the Civil Registry, as well as, say, the Ministry of Health, and maybe a couple of other relevant ministries, because that it's hard to provide a template here, because the situation and the setup, the administrative setup in countries differs, right? So in some countries, while the Ministry of Health may be responsible, in some other country, maybe you need to bring in the Ministry of Social Welfare. So you would have to see what the setup in the country is, but a strong partnership between the relevant national agencies. And if you're even open to it, getting CSOs on board, maybe getting experts from academia on board, I don't know, you might want to get the private sector on board for some reason. So you would have to internally think about who are the relevant stakeholders, because when you start planning for such an assessment, one of the first things that you should do is identify the relevant stakeholders who need to be involved at various stages in the assessment, and they may have different roles in the different stages of the assessment. Some people are data providers, some are users, and within the role of data provider and user, they may have different roles to play, or they can make different types of contributions to the whole process, right? There may be groups that the government doesn't know about, but the CSOs know about, and the CSOs can throw light on bringing those groups into the mainstream. So it's very difficult to say exactly who should be involved, because, as I said, you need to identify the range of stakeholders at the national level. But ideally, given that most of the data sits with the National Statistical Office and the Civil Registry in this case, in some cases, some relevant line ministries, they definitely need to be on board. And then maybe between the Civil Registry and the National Statistical Office, it's good for you to agree on who can take the lead, or maybe you set up a national committee and the committee takes the lead. You have a committee which is representative of all these groups, maybe 5 or 6 people, and then the committee takes the lead. So there are various formats in which you could actually do this. And yes, so don't be too intimidated with the word assessment itself, because it's not really a third-party assessment or somebody from outside coming to see what your system looks like. It's for the system to improve itself. And there are 2 angles to it. Not only would you be bringing in those marginalized groups into the registration system, but this is also about highlighting the data gaps, right? Because when you start doing the inequality assessment, you start to realize that data is lacking on these groups or on these issues, and then that feeds back into your data cycle, and you can also improve your data cycle. So it goes both ways. We probably we're not offering a perfect solution here, because as Renee mentioned, there's very little experience globally on how to conduct these assessments. As part of what the work we are doing, we're actually just trying our best to put together some guidance to take this forward. But yeah, we still have a long way to go to standardize all of this, because there is really no accepted method or procedure to do this. So all we can do at this point is learn from the experience of other countries. So some countries who may have done it already, we learn from their experience, what went well, what didn't, and try to improve on it the next time it's done. So I hope that addresses a bit of the concerns that you raised.
Yes, ma'am. Thank you. Thank you.
I see another hand raised, our colleague from Rajasthan.
Ma'am, that is one more question which my colleague from Andhra Pradesh, Balakiran, has asked. Just it is related to that only. My question, in fact, it was asked on the first day itself, but still somehow I was not convinced, to be very honest. So I thought I should, re-put the question again. The question was about, ma'am, data sources. Like what I understood so far, I'll just put in this way, ma'am. Please correct me and guide me. Like I'm an organization who is maybe the CRO or the NSO who has been collecting data, registration data on the incidences of birth and death, ma'am. And I want to ensure that the data which I have collected is qualitatively okay and complete. There's no registration, no person has been left behind, right, ma'am? And to assess it, or to ensure that the data is okay and complete, so I want to undergo an IA, inequality assessment, for which I need a parallel data, a data of an organization parallel in the government or an organization outside of the government, assuming that they have used the same variables, same parameters, ma'am, as well as the same universe, like the same sample or maybe the same population, and geography, ethnicity, and everything. If there is any kind of difference in variable, then I have to adjust with that, ma'am, as an organization. So that is what I understood. So also assuming that the data which is a kind of reference data for me should be complete in all aspects, so that unless until I assume that that is a perfect data to be compared with, then my assessment won't have validity. I just want to comment, ma'am, because whether I have understood it rightly or wrongly, ma'am.
Yeah, so what you're saying, you're on track. So you collect data from the civil registry, it's disaggregated by, say, sex, age, ethnicity, and what you're trying to understand is how complete it is. And so you're comparing it to another source, and you could have a variety of options for that source, right? So you choose the one that you think is best, that can also be disaggregated the same as your numerator from civil registry, right? And so from that, you do your calculations. And this is where the inexact science comes in, right? Because when you start to disaggregate by province, and then by ethnicity, and then by sex, and then by age group, you've gone down many levels. And at that point, using administrative data, you're probably not going to have as high a quality data as, say, from a census. So you are going to have some uncertainty, but at that point, you can probably draw some conclusions about this group is a lot more higher rates of registration compared to this group. And maybe the exact numbers you can't quite get right on, but you'll be able to see that differential, right? And so that's the purpose of this inequality assessment. So you can see, okay, population A is here, population B is here. We really need to focus our resources on B to bring them up to A, and that's how we go forward. Sharita, do you want to add anything to that?
Ma'am, may I know how many countries in the world have already done this IA? Can we also share their reports, inequality assessment reports, ma'am?
I mean, I'm not aware of anyone that's done a really in-depth one. I'm currently working with Fiji, and so hopefully they will be able to publish something in the next few months. I mean, but there's been pieces of this, right? So if you take a DHS or a mix, they look at birth registration and it is disaggregated. So it's not an assessment focused on birth registration inequalities, but there's little bits and pieces that have been done. So in that respect, it's not necessarily a novel thing, similar to death registration. Sharita, do you know of any other reports anywhere in the world?
Thanks, Renee. So maybe I'll just take this opportunity with this question from our colleague from Rajasthan. Maybe I'll just take this opportunity to quickly talk about our project and also see if additional countries are interested in coming on board this project. So Renee, would you mind if I just quickly talk about the project at this point?
Yeah, absolutely.
So colleagues, as you're aware, this workshop was actually organized as part of an ongoing project that we have been running at ESCAP to support inequality assessments of CRBS systems. And this is a key step in the regional action framework for the Asia-Pacific CRBS decade that's currently ongoing. And as part of that decade, inequality assessments were reflected as high priority. And so we started out this project. And as Renee has been constantly saying, there are actually very few countries that have done this. And we actually don't know of any countries that have done a full assessment with a full report. You know, they have done bits and parts of this work. And the reason for that is that to be honest, this is not easy. The assessments in themselves are not easy to do. And there is not enough international guidance on how exactly these assessments should be done. So what we're attempting through these workshops is to provide a way forward, but the guidance, you know, is still being developed. So as part of the project that we already launched, and we've started this work since last December, what we're attempting to do is conduct quantitative assessments of inequalities with regard to birth and death registration, and to develop guidance and provide technical support for countries to assess inequalities by evaluating and using secondary data sources. So we're not really going into any new data collection. We're just attempting to use secondary data sources from the censuses, household surveys, administrative data. And also we're trying to enhance capacity on indirect demographic methods for estimating vital events. And this project is basically conducting a series of regional workshops, as well as for countries that come on board. We will provide support to conduct a series of national workshops where you can actually initiate the inequality assessment process. So if a country comes on board and ESCAP is able to support the country, then what we would do is perhaps engage a consultant or an expert to work with the country. And then we will try to, so we will have a counterpart in the country, which is either the National Statistical Office or the Civil Registry. And this counterpart will basically help us to organize the national workshops. And these national workshops will not only be for capacity enhancement, but they will also be a way to actually begin the discussions on the inequality assessment themselves. So you will get the relevant stakeholders around the table. You will start looking at your data sources, the quality of your data. You will start identifying the subpopulation groups that need to be included in these assessments. So it's going to be the entire range of discussions that Renee has described to you over the last 4 days. So we will try to cover all those steps in those national workshops, and eventually, as an output of this project, the country will be expected to produce an inequality assessment report. It's not going to be a perfect report. There will be limitations. We know data, because we're working mainly with secondary data, right? We're working with existing data. So things are not going to be perfect, but to the best possible extent, whatever can be done within those limitations, we hope that every country that comes on board this project will be able to produce that inequality assessment report. And then that report can be used as a baseline. And then when you want to repeat the process, say in 5 years, in 3 to 5 years, or 5 to 7 years, you have that baseline to refer to, and then you know how you should make improvements in your data collection system, or which other population groups you need to look at, so that the next time you run the inequality assessment, you know what to change. So it's just a cyclical, iterative type of a process. So having said that, currently we have about 4 countries that have expressed interest. So as Renee mentioned, Fiji is one of them. Fiji has so far made a lot of advances in conducting their inequality assessment. They've already had a series of workshops inside the country for relevant stakeholders. They're planning another workshop very soon, in another few weeks. And as part of this project, we will also have a closing workshop in every country where we will invite the policymakers to join the workshop, so that whatever findings come from the inequality assessment can be brought and presented to the policymakers at the same time. And you can see how to take this forward into the policy discussions. So Fiji is one of our project countries. In addition to that, we've already started work in Pakistan. We've started work in Lao PDR, as well as Bangladesh, who is just coming on board, and they will take up their inception workshop and first capacity building workshop very soon. So I would just pause here for a moment, and after you've gone through all of these lectures over the last 4 days, and with the understanding that you have developed of what these, I hope that, you know, this process has put you in a better position to actually plan for an inequality assessment, or at least it has inspired you to conduct such an assessment in your own countries. And if you're interested, in being part of this project and getting some support from ESCAP, though I can't promise that we will be able to support as many countries as come on board, because obviously we have limited funding. But if you're interested, may I request you to maybe put your names in the chat box now. You could just type in the country name in the chat box and we will take note of that. And also you can reach out to us directly on the same email addresses that you wrote to when you were registering for this workshop. You can use the same email address. So if my colleague Panita can just maybe you can put in the CRBS email address here if you have it in the chat box, so that people can write to that email address if they're interested in undertaking an inequality assessment in their countries and would like to get some support from ESCAP. But it's also your opportunity to already put your country name in the chat box, and we will reach out to you if we have funds available and if we are able to support the process. So with that, actually, it's already past 2 o'clock. So Rennie, is there anything else, or should we make a closing?
No, I think the only thing I would add is just that the solutions will be in the exercise folder. I just uploaded exercise 9 as well, even though we didn't do it for your resources, and you know, feel free to reach out if you have any questions. But nothing to add for the technical side of the workshop. Thanks, Sharita.
Thank you, Renee. So colleagues, it's been 4 days, 4 long or short days, whichever way you see it. I personally, for me, it was a very productive, useful experience, and I hope most of you feel the same way. Actually, I just want to express a big thank you to Renee, who's worked very intensively with us to design the workshop, and she's so effectively delivered all of the sessions. And, you know, most importantly, she's based in the US, so it's been many late evenings for her. So a very big thank you to Renee for taking us through all of this. And at the same time, I want to thank all our participants actually who are again joining us from across these different time zones. So thank you so much for your dedication. We saw that, you know, some of you have joined every single session every day. So a big thank you. And I hope that you've been inspired to actually in some way influence somebody in your respective countries to undertake such an assessment. And you will be able to in the future get in touch with us so that we will be able to support you. And at the same time, I just want to quickly thank some of my colleagues who have been working behind the scenes. Panita, I think most of you are already familiar with her name. She has been supporting the logistics for this workshop for many weeks now. And also Nasikan, who has been providing oversight to some of the arrangements and logistics. So with that, I would thank you all once again. And as I said, please feel free to leave your country name in the chat box now if you feel ready to consider an inequality assessment in your country, or else you could write to the email address later after you think about it. And ESCAP will see in the coming months how best we can support you for this work. So if you have further questions, like if you keep looking over the lectures, you still have questions, please feel free to reach out to ESCAP again, and we will put you in touch with Renee, or we will get the answers for you and try to help you to the extent possible. So any last burning questions, comments from anyone before we wrap up?
I just
It's
also
not,
want to say thanks
yes,
to the colleagues
yes,
as well. And it's, you know, it's too bad that we can't do this in person, but it's great that so many were able to attend and we were still able to do something virtually. So thank you everyone for those who were able to participate and chime in. So it's been great.
Thanks, Renee, and thanks everyone. Indeed, as Renee said, online tools are not easy to use, and thank you for the best effort you've put in to actively participate in the workshop. So until next time, I'm sure we will be in touch somehow. So please take care, and thank you once again. Good day. Have a nice rest of the day. Bye-bye.
Bye, colleagues. Thanks, everyone.